Hello Hanover veterans. Ben Quell, your Veteran Service Officer, doing another broadcast here from my office. And things are starting to get back to normal somewhat. Businesses are reopening and folks are starting to get back out there, but it's important for us to continue to practice our social distancing, and especially our higher at-risk population, our elderly, continue to wear masks when you're in public and maintain those distances that are being taped off on the floor when you're going into retail stores and what have you. Today I wanted to get more into detail on something that we're seeing a lot of, which is using online video capabilities to reach out and communicate. My children were using a lot of Zoom sessions in their education this past few months during the pandemic. I've been using a lot of Zoom sessions here in my office for like VSO training, and also I'm a member of the Massachusetts VSO Association, so we're doing a lot of connecting that way. So it kind of gave me the idea that although I've put out a number of times about the Video Connect service that is being highly touted and used by the VA healthcare system, I thought that it was important to go into more detail on how exactly the veterans in our community can access and use this technology, coming to understand that, you know, the majority of my veterans are retirees, they're older, they just may not have a lot of background in using the technology that's required in order to have these video healthcare consultations with the VA, and so some of them may not be using it as much as they can. I have been using it. I exclusively use the VA for my healthcare, and I've had numerous Video Connect consultations with numerous doctors. It works great. It alleviates the need to expose our veteran population unnecessarily if they're really just looking for a consultation. And of course, during this consultation, if they have an ailment or a problem that's identified that really does need on-site treatment, that the healthcare professional that they're doing the Video Connect appointment with will immediately schedule them to come into a VA facility with a scheduled appointment. They're still using some techniques to monitor the traffic in and out of VA facilities, but it's working very well. They usually have a single point of entrance. They're taking temperature readings, and they're getting people through very quickly to their appointments. The question comes up, is there COVID testing going on at the VA healthcare facilities? Yes, there is, and you can get tested there. But getting back to the Video Connect, there are a lot of veterans, older veterans, that do have the technology in their homes. You don't need smartphones. You don't need a lot of whiz boom bang. A typical desktop, laptop computer can suffice. The Video Connect application is completely free, and it supports all major operating systems. iOS, which is Apple, web browser, Android, all the major things. So I would challenge any veteran out there to, if they have the technology, if they have a computer, laptop, tablet, phone, you most likely have the ability to get set up with VA Video Connect. So what I'm going to do now is I'm going to pause it, and I'm actually going to put the camera on my screen and just walk you through some things that might be helpful to you. Okay, folks, so this is actually a shot of my desktop computer here. So I just wanted to start with this because a lot of veterans out there, this is where a lot of people start learning about things that are out there and available. So if you really just wanted to put in VA Video Connect, you can see I've already done it, and then press on that. There'll be, the first thing that you come to right here is something that's put out by the VA itself. It's a mobile.va.gov. All you have to do is click on this, and it will bring you right to an informational page. And as you can see, all these major carriers all support VA Video Connect, whoever your server is, if you're looking to do this with a remote device. And there's a description here about what VA Video Connect is, real-time access to your healthcare team. And as you can see, it talks about the features. If you want to get started, it's a step-by-step. You can start it, you can get going right on your personal computer or laptop. You can use a smartphone. Now, if you are using Android or your laptop, there's nothing you need to download. Those devices are ready to immediately to join a VA Video Connect session. When you have scheduled one of these VA Video Connect sessions with one of your healthcare providers, you're going to get an email back from the VA with your appointment reminder and the hot link to join. Okay, they're sending this to the email address that you've chosen to do your video connects on. The easiest way, if you'd like, you can always call the VA and any of the VA. You can say you want to call the help desk at the Brockton campus. The customer service person comes on. You can just do it over the phone and tell them, I'd like to get video connect with my doctors, and I want to make sure that you have the right email on file that I'd like to receive my reminders on, and they'll put it into the system right there. There's a number of different ways you can join up here. I just want to make sure that you get the proper email in the system, because that's where they're going to send you a reminder. And on that email reminder is the date, time of your appointment and the hot link. So if you're using a laptop or you're using an Android smart device, all you have to do is click on that hot link and it will connect you to your healthcare professional. I suggest you get on 10 minutes early from the appointment and just leave it there and wait for the doctor to come on. Sometimes they're running a little late, but try to get on a little early. When you sign on, and I'll show you that in a moment, you'll put your name in, okay? So if you go to the waiting room, as I call it, the chat room, it'll tell you that you're just waiting for your doctor or your healthcare professional to come on. Don't worry, they know that you're on there. They see that you've connected, they see who you are. They're just probably finishing up with their last patient, okay? Now what I'm going to do here is, as you can see, there's download material for each of these different platforms. Again, the one I'm going to focus on is iOS, which is Apple, a very heavily used technology company. And the only reason I'm doing this is because this particular operating system does require you to go and download the app onto your device, whether you're using an iPhone, an iPad, or a what do they call them, MacBooks or what have you, okay? And this is what it looks like. It's very simple, okay? You will go to the App Store, which is the same place you go for any Apple device. And I'm just gonna replay that. I'm sorry, they did it kind of quickly for those people who don't download apps. It's the icon right here. Whether you're using an iPhone, an iPad, or a MacBook, it doesn't matter. It's the same icon. It's already loaded. You're going to click on that, and it's going to take you to your App Store. Now, you're going to have to know your Apple ID and password to download an app. Hopefully, you already know that. Okay, and this is basically what it looks like. You're going to put in, there's going to be a search engine, this thing right here. You click on search, and you put in VA Video Connect, and it will take you to this app right here. This is the one you want. It's completely free. You're going to hit open, and then it's going to download this free app onto your phone. Okay? Now, the VA suggests that you test the capabilities once you have it downloaded, whether you're using Android or whatnot, just to test your capabilities to make sure that your camera's on and working, your microphone's on and working. But that is how you do this, okay? So from now on, now that you have the app on your phone, when you get the, this is an Apple phone, of course, like mine. From now on, all you have to do is go to the email that was sent to you, click on it, go to the hyperlink that's already on there for your VA Video Connect, and just click on it. The phone itself will, if you're using an iPhone or an Apple or whatever, it'll automatically pull up that software you just downloaded, and it will connect to your session. And let me show you what that session looks like. I'm going to just kind of speed it along here. When you click on the hot link, it's going to ask you for your name. Obviously, the physician wants to know, or the doctor or nurse or whoever you connect, they want to know who's next and that you're on and who you are and that you're the person. Okay. And then as it comes along here, once they know it's you, this is what it's going to look like. This is it right here. It's going to bring you to this room right here. Now, either the doctor or the healthcare professional is automatically going to already be on there, and you're going to see their face. Up here in the upper right-hand corner, this is your camera. This will be showing you. But right here, eventually when the healthcare professional at the VA comes on, you're going to see them right here. Okay? And they're going to talk to you. They can hear you. You can hear them. The picture's very clear. And you will then, at that point, be in your Video Connect appointment. Again, I'm showing you an Apple phone here. If you are on a desktop, for those individuals who are working with an apparatus like the one I'm showing you right here on my desk that does not have a camera or it does not have a mic, okay, obviously it's going to limit your ability. You're going to be able to see them, you're going to be able to hear them, but they're not going to be able to see and hear you. Worst case scenario is you can still message them. You can talk to them using your keyboard, and they can talk back to you using their keyboard. I don't suggest this. If this is the only way you have, then I guess that's the way to do it. But if you can try to have somebody in your family, one of your kids, or just call my office. We have ways of connecting you and getting you the devices that you need so you can do your VA telehealth conferences. Okay, I'll even bring you over my Apple phone if I have to, just so you can get this done. I really would prefer that you're using some apparatus that has both a camera and a mic, so that you can, that physician can see you and hear you, and you can have a real good conversation. So I don't suggest you using just a desktop that doesn't have those things on them. The new ones all do. The new laptops and whatnot, Chromebooks, they all have these things, but I wouldn't suggest using a desktop that doesn't have those abilities. And that's it. You will be on this. Most of these things are lasting about 30 minutes. But if you need to show your doctor something, if you have something going on with you, then by all means, it's they can see it. And if they feel like the concern warrants scheduling an on-site visit, then they'll do that for you. The doctor or the nurse that's with you has full access to your records. They're doing this from the VA facility, so if you need a reorder or a prescription or whatever, they can do it during the session. So that's it, folks. If you have any questions or concerns, you're having trouble with this, or you don't have the technology, you need somebody to show you this one-on-one, give my office a call, 781-826-5000, extension 1107, and we will work through it together. All right, thank you very much, and stay safe and be well.